is the difference between a traditional PPO and an HSA plan? Is there coverage for braces on my dental plan? Can I use vision for contact lenses instead of traditional glasses? Do I have coverage in the event I experience an injury and can't work? Hello, friends. My name is Tony Zavala, and I'm here to give you a brief overview of the employee benefits offered through the Diocese of Fort Worth. Yes, insurance can feel complicated, but please know that you have a great team that is ready, willing, and able to help you navigate through those difficult and complex details. And with that, let's begin. To keep things simple, I will start with the similarities of both plans. First of all, the HSA and the PPO plans are built on the same platform. Both have annual deductibles. Both have out-of-pocket maximums on medical expenses. Both have in- and out-of-network benefits. Both use the same doctor network. And most importantly, both cover preventive care at 100%. What could even say that HSA is a type of PPO plan? In fact, when it comes to medical services like doctor consultation, surgery, or even prescription drugs, both plans provide coverage for those services. So then, what is the difference? When it comes to major services like hospitalizations, MRIs, and outpatient surgeries, insurance coverage will be applied after the insured has met the designated annual deductible. It's the minor services where the HSA and PPO plans deviate. To clarify, we consider minor services as doctor consultations, whether it's primary or specialist, urgent care or after-hour clinics, and prescription drugs. The traditional PPO plan has designated copays for these types of minor services. As a reminder, a copay is a recurring payment that the insured pays at the time of service. A deductible is only paid once a year. The HSA plan has no such copay protection. This means that regardless of the service, it could be hospitalization or prescription drug, the annual deductible must be paid. That's right. You as the insured are responsible for meeting your annual deductible before any services are paid under the HSA plan. This is the main difference between the HSA and PPO. Not being aware of this feature may catch an insured by surprise, especially when they are asked to pay the full cost of the prescription drug at the pharmacy. So, if the HSA plan has no copay protection and requires the deductible to be met before anything is covered, why should you consider taking the HSA plan? Well, the best feature of the plan is right in the name, HSA, which stands for Health Savings Account. The IRS considers this type of plan a qualified plan, where the insured could put away money tax-free. You heard right. You will not pay any taxes as long as you use the funds for what they're intended for, qualified medical expenses. These qualified medical expenses could be things that the medical plan requires, such as deductibles, but it also can be for expenses outside of the medical plan, for example, dental expenses, glasses, hearing aids, and many other services. Remember, the funds you deposit in your health savings account will never expire. Even though you no longer participate under the medical plan in the future, those funds will roll over from year to year. You have heard the phrase before, use it or lose it. This refers to a similar account called flexible spending account. However, please note, this use it or lose it rule does not apply to a health savings account. The IRS allows up to $3,550 if you enroll as a single person, or up to $7,100 if you enroll as a family. If you are of the age of 55 or older, your maximum contributions are increased by $1,000. The IRS refers to this as a catch-up provision. Don't forget, The IRS allows you to accumulate these funds year over year, and you can use them for any qualified expense without incurring a penalty. A list of all of the qualified expenses can be found on the IRS website under the IRS Publication 502. If you need to use your funds for non-qualified expenses, please know that you will incur a 20% penalty on top of having to pay regular income tax. So don't do that. Another important note, the HSA uses the honor system for tracking expenses. In other words, there is no third party that you will need to submit receipts to. However, I recommend you keep all of your receipts in the event of an IRS audit. So how do you know if you are a good candidate for the HSA plan? As you can expect, this question is different for everybody. But there's a rule of thumb people use to decide on what plan to enroll in: medical utilization. In other words, look at your medical needs. The HSA plan is great for the person that has low medical utilization. It might be an individual that has little to no medical conditions. Remember, the HSA plan pays for preventive care at 100%, so you can rest assured that your annual routine physical or well-woman exam will be covered in its entirety without any cost share on your part. If you're in this situation, you will have the ability to put away money tax-free into your health savings account and accumulate funds for later down the road when you truly need them. On the other hand, if you regularly take prescription drugs, have to consult with a physician multiple times throughout the year, or have a medical procedure coming up, the PPO plan may be best for you. This plan will have copays on many services where you will not have to meet the deductible. Like the HSA, the PPO plan also covers preventive care at 100%. Whichever plan you decide, remember that once your selection is made, you will not be able to switch your plan until open enrollment. There are special situations throughout the year where the IRS will allow you to make changes to your plan. We call these qualifying events. There are many variations of qualifying events, but please know that without one, no changes can be made until the next open enrollment. Your dental insurance is a traditional dental program. The easiest way to understand your program is by separating the coverages into 4 categories: preventive care, basic service, major service, and orthodontia. The first category is preventive care. With preventive care, your coverage will be at 100%. No deductible, no copays. Preventive care services include routine exams, cleanings, both panoramic and bite wing x-rays. With basic services, you have a small $50 deductible before the plan pays their portion. Remember, deductibles are only paid once every calendar year. Basic services include fillings, extractions, oral surgery, and most importantly, endodontics and periodontal services, which is root canals and gum disease, respectively. Once your annual deductible is met, the plan will pay at 80% for basic services. The third category is major services. This includes, but is not limited to, crowns, dentures, and bridges. The coverage for this category is 50% after you meet your annual deductible. For the first 3 categories, your plan gives you an annual benefit maximum of $2,500. This benefit maximum is yours and will not be shared among your family members. Each person in your family will have their own $2,500 and will reset every calendar year. The fourth category is orthodontia, or what we commonly call braces. Usually braces are only covered for dependents up to the age of 19. For this reason, Your dentist office may assume that you do not have this coverage for braces as an adult. However, please note, your plan does cover braces for adults and children at 50% with a maximum of $2,000. Unlike the benefit maximum for the first three categories, this maximum for orthodontia benefits will not reset and is a lifetime benefit. Your plan does come with a network of dentists you can use, but are not obligated to stay within the network. If you decide to use a dentist that is not contracted with your insurance provider, you may incur balance billing. Before I tell you what your vision coverage consists of, I would like to mention what this vision plan will not cover. If you are a diabetic, your attending physician may recommend you see an ophthalmologist every 6 months. If you have cataracts or suffer from glaucoma, your medical provider may recommend a surgery, special eye drops, or various other medical procedures. In any of these situations, your vision benefits will not help. Your medical insurance will take care of that. This vision plan is designed for services obtained at an optometrist, not an ophthalmologist. This program will cover routine exams, glasses, or contact lenses. Your eye exam and glasses are subject to a nominal copay, but they are limited to once every 12 months. For frames, the plan gives you $130 allowance to spend. Any overage will have to be paid by the insured. If you rather have contact lenses instead of traditional glasses, the plan does give you an allowance of $150 to spend. Although you can use this vision benefit at facilities that are out of network, please know that your benefits will be reduced. Having an injury or an illness that keeps you from work can be detrimental not only to your physical health, but it can also be disastrous for your financial security. This is one of the reasons why the Diocese has included short-term and long-term disability benefits as part of your package. Both short-term disability and long-term disability, they both pay a portion of your pre-disability earnings. With short-term disability, your coverage will begin 14 days after the injury or illness occurs. After this time, the benefit will pay at 60% up to $1,000 every week for 11 weeks. If your disability continues beyond this time frame, your long-term disability will begin and will continue until you reach the normal Social Security full retirement age. The plan does have an allowance for 1 to 2 years beyond this limit for employees that are actively working beyond their Social Security full retirement age. I hope you find this brief overview has given you good information regarding your employee benefits program. There are a lot of plan features that I could not go over because of time, but for your convenience and reference, we have created a benefit guide that will highlight a lot of the plan details. You can find this guide and other resources on the diocesan website. If for whatever reason your questions still remain unanswered after reviewing the material, please do not hesitate to give us a call. It will be a pleasure serving you. Thank you for watching.